I am going to demonstrate how to transfer the person from a bed to a wheelchair. Some persons are able to stand and pivot. They may have difficulty walking, or maybe they cannot walk, so they use a wheelchair for mobility. A stand and pivot transfer is used if the person's legs are strong enough to bear some or all of their weight, the person is cooperative and can follow directions, and a person can stand and assist with the transfer. A transfer belt or gait belt is a device applied around the person's waist and used to support a person who is unsteady or disabled. It helps to prevent falls and injuries. Always use and follow the safety and comfort guidelines when using a transfer or a gait belt. I'm going to start my beginning procedures, which is knocking. Hand hygiene is important before entering the room. Okay, good morning. I'm Deborah. I'm a nursing assistant instructor. And what is your name?
Cindy.
Is that what you like me to call you?
Yes, please.
Okay, so I'm checking your ID bracelet. And I would like to get you up into the wheelchair. Is this a good time?
Yes.
Very good. Okay, I'd like to pull the privacy curtain. Be sure and lock the bed brakes. After locking the bed brakes, I want to make sure that the height of the bed is the same height as the seat of the wheelchair. I also position the wheelchair next to the bed, locking the brakes. It's almost touching the bed. She also has non-skid footwear that I will put on her. And we want to make sure that the position of the wheelchair is next to the client's strong side. She's right-sided weakness, so when she comes in a sitting position, the wheelchair will be on her strong side. First, I'm going to fan fold her covers back. I'm going to ask her to cross her strong leg, or her weaker leg. I'm going to help her put it over her strong leg and then move it to the edge of the bed. I'm going to ask her with her elbow, kind of bring her upper body up just a little bit, and I'm going to raise the head of the bed slightly. And I'm going to assist her in getting in a seated position. Okay, Cindy is in a dangle position. I'm going to have her sit here for a couple minutes. In the process, I'm going to assist her with getting her non-skid footwear on. Very good, thank you. Next, I'd like to apply the transfer belt. This always goes over clothing and at the waist, with the buckle off to the side. And I'm going to snug it up here so that I can just get about 2 fingers in, complete the buckle here, and snug it up. Till it's snug. Very good. Now I want to grab a hold of the transfer belt. I'm going to put my left hand on the outside of her weaker arm. I'm going to ask her to push off from the bed with her strong arm, and we're going to stand. I'm slightly looking toward the position we're going. Stand and pivot. 1, 2, 3. Stand and go down with her into the chair, keeping my back straight. Okay, now that she's seated in the chair, I'm going to remove the transfer gait belt. Have her lean forward. Thank you. You can lean back. I'm going to bring her footrest forward now, protecting her leg. Rest her foot up on her footrest. Put them on over here. And I'll unlock her wheelchair brakes. And are you ready to go to breakfast?
Yes.
Very good. Okay, Cindy, are you comfortable in the chair?
Yes.
Do you need anything?
No.
Okay, here's your call light. And please call me if you need anything.